Welcome to Wisconsin's Youth Health Transition Initiative Learning Community, highlighting lessons from the field. Dr. Bekx is the director of the Pediatric Diabetes Program at UWHealthkids with a deep passion for improving healthcare transition for adolescents and young adults with diabetes. Dr. Nicksic recently completed the Pediatric Endocrine Fellowship at the University of Wisconsin Madison and is now a University of Wisconsin faculty member. She has been a key member of the READDY team and has presented this work at national and regional meetings. Doctors Bekx and Nicksic will present on the Getting Ready at School project, which looks at how healthcare providers and school nurses can collaborate to introduce healthcare transition to middle and high school students with type 1 diabetes. They will share their journey over the past 2 years in exploring the feasibility and then expansion of this project. Thank you so much for being here, Drs. Bekx and Drs. Nicksic. I am really excited to listen to what you have to share today. Thank you so much.
Oh, thank you, Tim, and welcome everybody. Good afternoon. Victoria and I are very excited to share this journey we've had over the last couple of years, getting ready at school, collaborating with school nurses for diabetes healthcare transition success. And just to kind of give a bit of a background, as Tim said, I've been involved in healthcare transition, focusing on type 1 diabetes for quite some time. And several years ago, when I was doing a presentation on a platform called DISH, which works with school nurses about healthcare transition, really it dawned on those on that talk, like, hey, what about healthcare transition in the school? And that's really what ignited our journey of thinking about how to integrate diabetes healthcare in school. So next slide. There we go. All right, so I do want to introduce, we are called the READDY team, and you'll understand the acronym READDY in a couple slides. But as with anything, you need to have a well-oiled team to be successful, and a compassionate team and a passionate team. So I do need to recognize our school nurse team members, Laurel Cornelius and Gretchen Forbes, who are kind of our representatives of the school, who have been key players in implementing this into the school system. Laurel is head of one of the school district and really plays a role in orientating the school nurses, elementary, middle school, and high school. Gretchen has been a high school nurse for quite some time and really has a passion for meeting with her students with diabetes and really guiding them through their journey. For the UW team, it's myself and Victoria. In addition, we have Carrie Wire, one of our APP nurses who's really taken on a role as a leader in healthcare transition, and Whitney Beaton. And finally, of course, we have Tim as a member of our team and has really been helpful providing that lens of healthcare transition from outside looking in. So our team has gathered and has started this journey a couple of years ago. Next slide. So of course, I'm speaking to the choir here. What is healthcare transition? You guys know healthcare transition it's a process of how do we take a child, adolescent, young adult, and help them manage their diabetes from this child-centered model of healthcare we see in pediatrics to that in the adult. And again, it's a process that takes much time. And typically for us in diabetes, it culminates in the transfer of their care to an adult diabetes provider. And we know this process, although it's advocated and we understand the importance of it, really implementing it is very challenging. So next slide. So I know everybody here is not familiar with diabetes, so I want to kind of take you through what it entails to manage diabetes. So on the left side, you can kind of see our list of things. So for people with diabetes, there is intense daily management. They need to be knowing what their blood sugars are, most by wearing a continuous glucose sensor or checking blood sugars. They need to look at the food they eat and the carbohydrates in that food. They need to determine insulin dosing based on their blood sugars, their carbohydrates. They need to understand what to do if their blood sugar is running too high and how to treat emergently a blood sugar that's too low. So that's daily management. I tell my patients they make 1,000 decisions every day. Then there's the part of navigation. How do we navigate our complex healthcare system? How do we fill prescriptions, make appointments, work with insurances, DME teams, calling the diabetes team? We have an area of health behaviors. So driving and diabetes, alcohol and diabetes, reproduction and diabetes. Again, thinking about that emerging adult content. And then really making sure our patients understand and know what is type 1 diabetes? What are the long-term complications? How do they manage sick days? So we have to take all of this that's on the left side underneath the parent guardian and shift it to the young emerging adult. And that young person is, in addition, balancing all this and learning all this, is balancing school, juggling time with friends, has distractions on their cell phone. So this big question mark, how do we move this from the left to the right? Next slide. So it's a challenge. And the key thing when we're looking at this is looking at identifying a tool, and that will be the READDY tool I'll be describing in it shortly. And then finding the time and opportunity. And this is when we started talking to school nurses. We're like, hey, we have some time in here and an opportunity where school nurses can play a key role. Next slide. So I'm going to take a little bit step back and talk to you about the READDY tool. It stands for Readiness for Emerging Adults with Diabetes Diagnosed in Youth. This was developed and designed by pediatric endocrinologists in Cincinnati and Seattle. And they had a team of health psychologists, diabetes educators, dietitians, nurses, and really kind of thinking about designing a tool where the young adult's going to have a self-reported confidence level by a Likert scale on the various things they need to know as far as diabetes healthcare transition. And then utilizing this tool to identify areas where they could intervene. Next slide. So this is an example of this tool. It is a 44-item tool, so it is a lengthy tool. And the areas of question and assessment are broken down into that of diabetes knowledge, navigation healthcare system, self-management, health behaviors, and then for those on pumps, specific questions pertaining to insulin pumps. And as you can see here, so for example, it's a Likert scale. So describe diabetes in my own words. And that young adult, adolescent is going to, where am I with my confidence in that? Everywhere from, yes, I can absolutely do that, to haven't even thought about it yet. Next slide. So we have picked that tool, the READDY tool, but then the next question is, of course, time and opportunity. And again, as I was meeting with this group with the DISH and school nurses, we're like, kids spend a lot of time in school. We encourage them to interact with their school nurses. And even the National Association of School Nurses position statement has really said, hey, school nurses can be key players in coordinating healthcare transition. And so we want to take the opportunity to utilize school nurses in this process. Next slide. Nope, back one. Year one. Okay. So, as with any project, we have to start somewhere. And, as we were talking, the question is this feasible? We appreciate school nurses are well stretched, that they not only manage kids with diabetes, but manage kids with other healthcare issues. And so is this something that school nurses will be able to do with time? Is this something that the students will participate in? So we really decided we were going to pilot it and keep it simple and straightforward. And so collectively, our group said, hey, let's just pick 5 main questions on diabetes, focusing on blood sugar and insulin management. And let's take those 5 questions survey, and we're going to distribute it to middle school students and high school students and see if they fill it out. And then we had them repeat that in the spring with some surveys getting feedback. So again, we're really testing the feasibility. It worked. We had some participation, but we got feedback from students and nurses, and Gretchen specifically worked with a high school advisory group, and we got some information from nurses about this process. And with that, we were able to make some changes. So next slide. So year two, after all this feedback and discussion, really wanted to think about how do we increase participation, not only with numbers, but engagement. So Laurel, again, was huge in kind of managing this increased numbers. She really presented the READDY project to all the school nurses in the district during orientation in the fall. She made sure that they had access to the READDY tools and resources on the school website. She campaigned this and certainly followed up with school nurses. Hey, have you gotten through this with your students? Have you gotten any data? And then she gathered the data and responses and shared it with us anonymously. So next slide. Oh, next one. There's one we're missing. Oh, I must have shared that. Okay, increased. I must have. Oh no, go ahead. I'm sorry. Next slide. That's right. Actually go back one. Sorry about that. All right, sorry. So this, I wanted to include this as a picture of the website that Laurel put together. So this was on the school website, and school nurses would have access to the survey. It was a Google form, paper form. In addition, we put together information for any parents and the school administration of what our goal was. We had different PowerPoint resources available. One was one that she presented during orientation, to explain the READDY project and why we were doing it. And another PowerPoint that Whitney put together, just a general background about type 1 diabetes. And then, of course, we include information for English and Spanish. So Laurel did a lot of work. Next slide. Okay, so the next part we wanted to do was increase participation by increasing engagement. So with feedback from the high schoolers, they're like 5 questions. Those were too easy. We can handle the full READDY survey. And then what we did for middle students is that we truncated it to just 23 items because some of them really weren't applicable. For example, questions about driving and diabetes. Then we asked each student to select a specific learning topic from the READDY tool. What's something that they feel like they'd want to learn about in the coming year? And we asked them to meet with their school nurse and use the educational materials that our team provided and talk about it, learn about it, engage about it. So next slide. So this was the educational materials that our READDY team put together, and we aligned it with the specific areas that were on the READDY tool. So for example, what is diabetes? What is a hemoglobin A1C? And we aligned it with resources that could answer those questions and give background information and provide it in both English and Spanish. So when the school nurses did find time to meet with their student to talk about that learning topic, it was really accessible and easy for them to find resources and ways to guide that conversation. So next slide. And next, Victoria's going to talk about her results.
So moving forward, I'm going to spend a little bit of time just talking about the data that we've gathered and the results that we've gleaned so far in the 2 years of this project. So like Dr. Bekx was mentioning, in the first year of the project, our goal was really to understand, is this project even feasible? Will nurses have time to deploy these tools? Will students participate? And in that first year, we were able to work with 8 schools in a local public school system. 5 of those schools were middle schools and 3 were high schools. And within those 8 schools, that first year, we had 19 total students with type 1 diabetes participate. So 19 students filled out that READDY tool at the start of their school year. 11 of those students were middle schoolers and 8 were high schoolers. And then 17 of those 19 went on to repeat that READDY tool at the end of the year as well. So we only lost 1 student in each of those groups. Next slide. And so our kind of takeaways from that first year is that people are willing to participate this, and it does seem feasible. And not only that, but in asking more feedback questions from both the students and nurses who participated, it really seemed like people were also interested in this project. And there's buy-in from those students and the nurses as well. And like Dr. Bekx was sharing, feedback also included information from primarily the high school students that they were willing to take on a larger number of challenging questions from the READDY tool. Nurses were very open with their feedback as well, and were really asking for a way to make this project more interactive and really asking for more tools that they could use to provide education to their patients, which we've been working on. Next slide. And so then moving forward to the second year, again, our goal is really, now that we've deemed that this project is feasible, our goal is to expand the project through project promotion and more project marketing. And you can see here that between the first year and the second year of the project, we really were able to expand, capturing 2 additional middle schools and 2 additional high schools, which represented 12 middle school students with diabetes, all of which selected a learning topic. And then we really captured a much larger number of high school students, going from 8 in the initial year to 20 who participated in the second year. And 16 of those students selected a learning topic. And then there was also change in the number of nurses who participated, going from 9 in the first year to 15 in the second year. Next slide. And then we gathered the data. Not only were we collecting information on how many people were participating, but we really dove into their learning topic selection and compared the learning topics between middle schoolers who participated and high schoolers. And you can see here with these pie graphs that the largest area of interest for both groups, the middle schoolers and high schoolers, was really learning more about diabetes knowledge. And then when we took it one step further, you can start to see differences between these 2 groups, with middle schoolers being more interested in learning about insulin self-management, where high schoolers, probably appropriately so, were asking more questions about health system navigation. Next slide. We again took things one step further and asked more questions of the students, who really shared that when they spent time working with their school nurses, learning about that learning topic that they had selected, that they felt like their school nurse was the key to their education and really the driver in increasing their confidence in their self-selected learning topic. So again, in total, 28 of the 32 participating students picked a learning topic, and 23 of those students rated their own self-confidence in that learning area at the beginning of the study and the end of the school year. And we saw that 70% of those students showed a positive improvement or an increase in their confidence in that self-selected learning topic. Next slide. We asked them more questions as well. And we saw that almost all middle schoolers and about 2/3 of high schoolers shared that they felt like it was helpful to complete the READDY tool. They also went on to share that they felt like completing the READDY tool helped them communicate better with their school nurses. And then again, most middle schoolers and just over half of the high schoolers also felt like completing the READDY tool gave them more confidence in their diabetes skills. Next slide. We also went on to ask the school nurses who participated in the second year for feedback, and most of them were able to provide feedback, and 85% shared that participating in this experience really increased their engagement with their student with type 1 diabetes. And not only that, but nurses shared that they really appreciated the educational materials provided by our team to utilize in education conversations, and that they learned things themselves about diabetes that they didn't know before. They also described that their relationships with their students with type 1 diabetes improved related to participation in this project, and that school nurses found a lot of satisfaction in seeing the confidence in their students with type 1 diabetes grow throughout the year and grow throughout their interactions. Next slide. So as you can imagine, in the past 2 years, we've done a lot of conversing about this project, and we've realized that we have really learned a lot, much more than could be captured on any number of slides. But the main things that we have learned is that something like this really is possible, though it certainly requires buy-in from both a healthcare system and, very importantly, a school system with interest and engagement. And that really, to make a project like this successful, we really needed project promotion, and that required that buy-in from the school nurses. And as you can imagine, working with 2 very big, busy systems, communication is really critical as well to ensure that our systems are working well together and functioning side by side. It was also very clear to us that we are better able to capture middle school students. And our thoughts on this are that middle school students are still more reliant on their school nurses for help with their diabetes needs day in and day out, and have more set check-ins with their school nurses. where it was harder to capture high school students who may be more independent in their diabetes care at school, or maybe are at school less often because they're more likely to be doing virtual school or taking classes off-site. And really, another thing that's been very interesting for us to observe over the past 2 years is the potential discrepancy between the students' self-reported self-confidence and the potential ability to demonstrate any given skill. And currently, the READDY tool, like described by Dr. Bekx, is really asking students to report their self-confidence, but right now it's not tied to any sort of demonstration of skills. And we have received feedback from some of the school nurses that they may have not described the students' abilities in the same way that the students describe them for themselves. Next slide. And so our hope for this project is to really continue pushing it forward. I feel like I'm speaking for both of us that it's been really exciting and fun collaborating with the school nurses, which has been entirely new opportunity for me. And we hope to continue that collaboration and really push it forward. First, by expanding this project into the elementary school setting, where I feel like we have a huge opportunity to really build some foundational diabetes knowledge for students who may be early on in their diagnosis or have not learned diabetes in another way yet. We also really hope to continue to engage with students, and I think we're quickly realizing that we need to meet students where they're at and communicate with them in ways that work for them, which is less about using paper these days and more about using technology these days. So we're learning and working to do that as well. And that really builds upon the resources that we're creating as well, which currently include resources really that could be used by people with diabetes, any chronic health condition, or really just any patient transitioning from pediatric to adult care, focusing on that healthcare navigation piece of things where adolescents may need more information on how to fill a prescription, how to understand insurance, how to call and make a medical appointment. We're also working to build our repository of information in Spanish, as well as expand our tools so that they can be geared towards younger students as well as those who require individual learning needs. Next slide. So that's all the material we have prepared for you. But again, thank you for this opportunity to share this project with you. And we would be happy to take any questions here or have you reach out to us with our emails as well if you think of questions at a later time.
Thank you so much, Dr. Bekx and Dr. Nicksic, for sharing this exciting work. Thank you also for letting me be a part of the team. It's been really exciting to watch the excitement of the school nurses grow and just seeing them see how much they can influence those students into taking care of themselves as adults. So we're now going to open up for questions. You can type your questions in the chat. If you unmute yourself, we will see that you are unmuted and we will call on you to speak. We do have one question in the chat that I'll read out for you. The question is, did families have an active role in supporting this learning? Did school nurses provide feedback to families to give them supports for home environment, community, for sustaining this growth in learning? So that intersection with that medical community, with the family, with the schools, were you able to learn anything about that?
No, that's a great question. Not as much as we could have or should have. I guess that's something for us to think about. We did really want to inform the family that we were starting this process, and informing the family that they'd be spending time with their student on looking at healthcare transition. We didn't directly interact with the family. I think part of it's a little bit, some of the patients or the students aren't necessarily our patients. They might be at another healthcare place. So that part's just a little bit tricky. I think it might be something for us to think about how to do that independently. When I see patients in clinic, I am clearly interacting with the family on healthcare transition. So you're right, it's a little bit of a triangle, and how do we get all of those pieces to connect is a great point.
Please feel free to unmute and we will call on you or raise your hand. Judy?
Yeah, hi. I apologize. I joined late, so I missed the intro. But what I did get is the fascinating work that you've done here. My connection with Waisman is I did some work with them on the transition program back when I was doing my doctoral project. But I was intrigued with your data that showed that the middle schoolers felt more confident. I mean, both of them were more confident, but the middle schoolers were much more so than the high schoolers. And then also your comment about how the middle schoolers were easier to connect with versus the high schoolers. So I wondered if there was some kind of correlation or connection there in that the middle schoolers just were maybe more, for lack of a better word, maybe a little more vested at that point than the high schoolers. But then I also appreciate your comment you made just toward the end here about how to make all those connections with the transition, because as I'm thinking about the transition process and how you can give it in nuggets and start early, like in the early ages. I know the school talked about 14, 15, but in my work with transition, you can start much earlier than that, and helping the kids to understand a little bit about what their needs are. So I'm intrigued with the fact that you're looking at elementary for that reason too, as you go forward. But then also kind of intersecting the teaching, the learning opportunities with the transition steps. So it's sort of like they go like side by side as the kids do the learning with the school nurses. So it was just some thought that came to my mind in regard to what your data showed. I appreciate the fact that you're working with the school nurses, because that my background is more working with people with intellectual disabilities, and that is a whole nother area that school nurses in some cases maybe don't know a lot about. Diabetes is fairly common, and disabilities are out there too, but the education for nurses has not been that rich when it comes to disabilities, especially intellectual disabilities. So I appreciate the work that you're doing with the school nurses, and I commend you for this. And that's just some thought that I had based on what I heard.
Oh, thank you. Victoria, do you want to, or you want me to
Yeah,
address?
thanks. I feel like there's a number of really great thoughts and comments there. So thank you for sharing those and giving us feedback as well. I think we really echo a number of the things you sort of gleaned from this as well, and that it really was easier to capture middle school students. And I do think we haven't found a way to test this definitively through our data yet, but it does feel like they really are easier to get excited and invested in this project, where high schoolers seem to just have a lot more competing commitments. And that's really natural when you're getting older and working towards a number of new goals,
Sure.
like
Sure.
leaving your home, getting to college, maybe having a job. So I think that all sort of plays a role in the challenges related to healthcare transition in general, which is all that much more complicated when you're living with a disease like diabetes that's very complex and relentless. So I think that just speaks to the challenges and also sort of highlights our desires to reach students at a younger age where they're more easy to reach and potentially a little more moldable still, because they're potentially earlier in their diagnosis, or we can just have more opportunities to provide them with the education we think that they would benefit from. It's a little interesting thinking about the self-reported confidence and how people
Sure.
sort of check the boxes for themselves, because sometimes, especially when we did that truncated survey the first year, we saw a lot of fives. Like a lot of people just said, yes, I got this on almost all 5 questions. And so it's really tricky right now to understand, because it's not tied to any demonstration of skills. Like
Yeah.
you're confident, but can you do it alone?
Yeah.
So that's one area too. I think with time, we'll just try to see if we can tease out how this potentially matches with glycemic control or outcomes or rates of comorbidities. So I think there's a lot of room for this project to grow, and we
Yeah.
are just really excited about it.
Yeah.
Yeah.
It's a
Yeah,
great
I
project.
agree. The only other thing, I think a couple things. One, high schoolers naturally maybe a little overconfident, which and they, as Victoria said, they've got their thing, and they may or may not be filling this out with true insight. I don't know. And I guess what I mean by that is like we are looking at specifically what high schoolers picked for a learning topic. And interestingly, the middle school students, when they looked at learning topics, a lot of them picked alcohol. We're like, oh.
Oh.
And it was interesting, the high schoolers, if they looked at more knowledge, it was more talking about A1C. But when you looked at like the high schoolers as a group, their scores were like 4s and 5s on A1C. So I thought, well, how interesting that they picked a learning topic that they self-assessed that they're already actually pretty confident on. So maybe they're not so confident. And that's okay. You know,
Yeah.
they're getting what they need. As far as the elementary students, so Laurel is one of the she works in elementary school and really saying, hey, these school nurses in the elementary school, they're interested as well. And clearly the READDY tool is not one that can be applied to elementary students. So what we're piloting this year is we've found some videos on YouTube because kids like also other things like how do you learn, right? So we found these videos. There's just 4 or 5 of them. It's called Diabetes Besties, and it's a cartoon about some animal that has diabetes and talking about why do I take insulin? How do I give insulin? What is diabetes? What is a low blood sugar? There's 4 or 5 of them. And so this year we're just providing that link, or I should say Laurel's providing the link on the website and encouraging the elementary student nurses, hey, we would ask you to sit down and at least watch one video with your student this semester and let us know if this was doable. Was the student
Oh.
engaged? Did you find these videos were helpful? Yes or no? So that's kind of what we're doing with that.
Okay, thank you.
Yep.
Yeah.
Oh, and that brings up another thing. So kind of talking about how people learn. The other thing we did with these surveys is we asked, how did you learn about your topic? The majority of them said, with their nurse. And then we asked, well, how do you like to learn, or what ways would you like to learn, i.e. social media? And a lot of them put TikTok, no surprise, right? So what Carrie, our nurse practitioner, did was really kind of looked at resources that we felt were trustworthy, and that we could provide for students to get information on type 1 diabetes via a social media. Because again, we have to meet them where they're at.
So we have a couple other questions that have come up in the chat. One is a thank you for offering Spanish information. Do you have any programs or education for families with kids with special needs who also have diabetes?
So do we have any, we don't have a particular program. I think that has really been, I've done this in clinic, and again, it's meeting the student where they're at and what we think where they're going to go. So for example, I might have a adolescent with autism and type 1 diabetes, right? And talking with the parent who's managing the majority. And the question is, well, what of that whole list do we think we can transfer over to the young adults? And so it's somewhat individualized. It might be, do they know how to check a blood sugar, or do they understand what a low blood sugar is? So it's very individualized. I think with the school nurse project, it's going to have to be individualized for those students with special needs, and finding, well, what tools are out there. Again, what we provided were links, and a lot of it was reading, but maybe also have to think about links that are cartoons or videos.
Thank you. Question that, maybe you've thought about, but how might the feasibility of the model change for schools I'm going to read this correctly now for you.
Mm-hmm.
How might the feasibility of the model how might the feasibility of the model change for schools in rural areas where there is no on-site school nurse?
Victoria, do you want to try that one?
Go
Yes.
for it.
Yeah, I'll take it on. So I think right now the model really relies on there being someone invested on the school side of things, whether that be a school nurse or potentially in the right school system, a school administrator or some other adult in the school trying to help those with diabetes, because we do have a number of patients who attend schools where there's not a nurse full-time, though there's always an adult who's been identified as the person who this student with diabetes would go to for help or assistance with administering insulin. So I think there really would be, it would really necessary to have buy-in from that person, though it might not always be a nurse. And I think currently as the model stands without that sort of collaborating adult in the school system, this project wouldn't be as successful.
Yeah, I agree. I think, you'd have to identify someone who was comfortable in discussing healthcare issues and diabetes. And maybe it's the health teacher or, whoever is kind of helping that young person with diabetes in the school. And then, certainly then I guess we could provide resources, and we do this, obviously we provide resources to our families who are newly diagnosed, but making those accessible. So I think it's doable. It might need a little pivoting, but I think it's doable.
We also had someone comment at one time there was a grant to students who were paid to participate. She thought she saw that on one of the slides. Did that continue in year 2? Are you planning on continuing that as
Oh,
an
I love
incentive?
that. Yes. So year 2, we did have an R&D grant actually to support students, nurses, and such. We do not have that this year. So we're really going to be testing the feasibility if we don't have that carrot for the students. So we'll see what happens. Nope, same I lost you.
Are there others who have questions? We don't have any more in the chat, but we welcome others to raise your hand, come off mute.
I guess I would just say we are definitely, looking at, we've done this in one school district, and, the question is this feasible to expand to other school districts? So if there are people who think, yes, I'd like to be involved, obviously feel free to reach out to Victoria and myself. I think our key interest is obviously, we can provide the resources. And for us, we would want to keep track certainly of just number of participating students. And I think we want to keep on gathering that learning topic selection because we're finding that's very informative.
The one question that I don't know if I can't remember if we've talked about this before, but now that you've seen the success with a discrete group of students with diabetes, do you think this can form any sort of model for school nurses in the overall process of helping kids with special healthcare needs transition? So
Victoria, do you want to take that?
Yeah, I think yes is the answer. And I think truly, as Dr. Bekx mentioned a little bit ago, even the National Association for School Nurses really calls out that school nurses are very well positioned to aid in healthcare transition. I think this is still challenging though because of the number of requirements and responsibilities that even they have every single day in caring for all of their students with a variety of healthcare and our social needs. But I think this really could be a model, or at least a skeleton of a model that could be applied across subspecialties.
Well, and Victoria, why don't you share some of the things that you've been working on?
Yeah, and I'd love to. And that's in doing this work, I think we've sort of identified where we've seen other gaps, which are not specific to diabetes. And, there's a number of wonderful resources related to transition, but we found some gaps in resources that are targeting the adolescents themselves. There's a number of resources on transition readiness assessment that are non-specific or, not disease specific, a number of resources on the timeline for transition, and like mentioned, how it should really start early, even when you're 11, 12. But there's not a lot of materials targeting students. And that's where we've spent some more time recently creating materials for adolescents to help them understand how to fill a prescription, information on the basics of insurance, information on how to store their medical information, how to make an appointment. And that's really sparked a lot of conversations that I've had recently with our institution on how we can create these materials and also market them to the local area for students who are cared for in UW and even outside of UW.
So we do have someone who's interested in connecting. So they just if you have the chance to put a contact email into the chat, that would be great so they know how to contact you. And have you thought about looking at other states or even healthcare systems to test out the Ready tool? Like, have you received that pot of money to do whatever you dream of?
No.
Not
Oh,
yet.
Well, I would say, the Ready tool has been validated. So I think, thinking about testing out how to use Ready in the school system is really kind of what we want to focus on. I think, yes, we would love to see how can we expand this. And certainly people are interested. We'd be interested in working together. Because then you can learn from what we've what the mistakes are not mistakes, but the lessons we've learned, you can learn from us, right? And again, I think looking at, people want to know metrics and does this work? Is it, is it feasible? Are students learning from it? Are they gaining from it? So I think whoever we would partner with, or if you're interested in partnering with us, we would like to continue and not just have it a single stagnant event where here's a bunch of stuff, go for it. We want to be engaged so that we can learn together. I know, Victoria, if you have other thoughts.
No, I echo that completely. I think we're hopeful for ways to keep expanding this model and would love to communicate more about how we might be able to do that.
other questions, please raise your hand or indicate on your screen or place it in the chat. We have just a couple of moments left here for questions. All right, let's go ahead and move along. Thank you again so much, Dr. Bekx and Dr. Nicksic, and thank you all for joining and sharing with us today. The interaction, the questions were great. To help us improve our learning community, please answer the poll questions that you have on your screen. A recording for today's learning community will be on our website within a week. Recordings from all previous learning communities are also there. We've been doing this a little while. We want to put a special plug in for you to watch September's learning community with Special Olympics of Wisconsin. Excuse me one second. Wisconsin on their inclusive health strategies, the Unified Champion Schools program, and the brand new Rosemary Collaboratory to impact youth of transition age. So please feel free to go and check that out. Also at our website, you'll find information on the upcoming Transition Talks Tuesdays series, Transition Table Talks for parents, upcoming workshops, and how to join the Transition Transmission listserv. There are currently no Youth Health Transition Initiative Learning Community webinars planned for 2026. Due to a change in funding at the Wisconsin Department of Health Services Title V Children and Youth with Special Healthcare Needs program, the Wisconsin Youth Health Transition Initiative, YETI, will be ending its statewide work as of December 30th, 2025. This includes activities such as the learning communities, workshops, including Transition Talks Tuesdays, Transition Care Mapping, Build Your Bridge, Bridging the Gap, the other workshops we hold. It also will end the consultation we have with transition partners to incorporate healthcare transition into other transition efforts. The Weisman Center is pursuing ways to continue this important systems change work and welcomes partnerships to continue helping youth, especially those with intellectual and developmental disabilities, become healthy, successful, self-determined adults. I also want to let you know about another project at the Weisman Center that I'm involved in called the Wisconsin Autism Transition Demonstration Project. We have an upcoming kickoff meeting and we'd love to have you join us in this project. The project's goal is to better connect the different systems that help autistic youth as they become adults. The focus is on autistic people ages 13 to 26 with more challenging health or social needs who need more support than other young people. Janesville, Wisconsin is our first site. What's found helpful there can then be shared to other Wisconsin communities. To accommodate more people, we're offering two options to attend the same virtual Zoom meeting. First, on November 25th from 3 to 4:30 p.m. or December 9th from noon to 1:30. The links will be in the chat if you would like to join us. Thank you all for joining us today. Thank you for your partnership over the years. Have a great rest of the day.